Okay. I have made this video to demonstrate how to use the ultrasound machine in the Veterinary Teaching Hospital. A set of written instructions is kept beside the machine, so you can always find the written instructions. These instructions can also be found on the e-learning link, which is on the veterinary faculty page of the AFU website. There are two main components to the ultrasound machine. There's the display unit here, and there's also the probe. Now the probe is a curved probe. It's very delicate. Do not immerse the probe in any liquid, any alcohol or any water, but after use wash it with a soapy cloth. The grey area here is where the ultrasound is produced and collected. So this is called a probe or transducer. The ultrasound displays on the unit just like with radiography. In other words, anything that's gas or liquid appears black. Anything that's more solid tissue appears white. This type of probe is good for small animal abdominal examination, although I've also used it to diagnose traumatic reticulitis in a cow. There is a notch on one side of the probe. If you place your thumb on that raised notch when you're taking the ultrasound, then the picture on the monitor will be orientated similarly to as if you were taking a radiograph. Let's now have a look at the control panel situated at the bottom of the screen. On the very right is the on-off button. On the very left is a multifunction button, followed by an optimize button, and then the patient list button, the save button, and the freeze button. This is what the ultrasound screen looks like when the machine is switched on. More controls on the bottom. We go to the function button on the bottom left to enter in a new patient. We then move along to the bottom right of the screen. We click on patient list and select new exam to enter in a new patient. Enter the patient details together with the reason for the examination. Place the patient in right lateral recumbency and clip the hair from the ventral abdomen and flanks. If this is not possible, apply surgical spirit to improve the contact with the probe. Place your thumb on the raised notch on the probe so that the image of the ultrasound is orientated the same way as a radiograph. Apply sufficient gel to the grey head of the probe or transducer before applying the probe to the patient. Begin your intra-abdominal ultrasound examination with the liver, since this is easily located near the sternum and the last ribs. Here we can see a smooth white line indicating the outline of the liver. It moves according to the animal's breathing, and the gallbladder is enclosed clearly inside the liver. From the liver, we move the probe round underneath the last rib, looking for the spleen and then the kidney. Here we have the kidney. When we have a clear image of the kidney, we press the freeze button in the control panel, and then we can identify the various components of the kidney. We have the white renal pelvis with the calyces, and then we have the dark fluid-filled pyramids in the renal medulla, and then we have the cortex. We can now take various measurements by pressing function in the bottom left and then measure in the bottom right. Touch the screen where you want to begin your measurement and then press the tick to accept that. Do the same at the other end of the measurement. Touch the screen and press the tick to accept, and here we can see that the medulla measures 2.44 centimeters. If we do the same for the renal cortex, we can see that it measures 0.92 centimeters. We can now go down to the control panel underneath the screen and press the save button, and that will save the screen and its measurements to the patient file in the ultrasound machine. We can magnify a frozen image by touching function and then zoom, and then tap tap the plus and the minus images on the thumbnail to zoom in and zoom out. Tap the icon in the top right hand corner of the thumbnail to close the zoom function. As well as using the freeze button on the control panel to freeze an image on the cine video, use the same button to unfreeze and return to video function. When the cine video on the screen is frozen, you can either save it by pressing the save icon in the control panel, or press Save Cine on the screen, or you can replay the cine by pressing autoplay, then selecting the speed you want to see it, either 1/4, 1/2, normal times 1, or speeded up times 2. Once you've finished reviewing the video, press times 0 to stop the video. You can compare up to 4 different frozen images or cines on the same monitor by selecting Mode and then pressing either 2B or 4B. This will give you a split screen on the viewing monitor which looks like this with 2B, or else like this with 4B. To review an ultrasound belonging to an existing patient, select Function and then Patient List and select the patient, and then either press Review or New Exam to review or take another ultrasound. I hope you have found this video helpful. We have looked at examining the liver and the kidney. You can of course go on and look at other internal abdominal organs such as the spleen and the urinary bladder, the intestines. And remember also that you can always find a set of instructions for use by looking up the veterinary faculty page of the AFU website and clicking on the e-learning link and searching for Ultrasound Machine.